This is my finalized video presentation for my third year seminar class at Lewis University. My name is Ben Lind, and my video topic is about bicep curls and calf extensions. These two weight training exercises are some of the most common methods for training their respective muscles. However, I will primarily be focusing today on bicep curls and later on calf extensions. I will also be showing video clips of proper form and techniques of these exercises. Bicep curls are so basic in their entirety, meaning their primary muscle focus is obviously the bicep. However, a structured form is still important as most unexperienced people do them wrong. Calf extensions, on the other hand, are also extremely common, but it is still crucial to do them correctly, or a serious injury can occur. To start off with proper form and technique for bicep curls, one must account for two things: correct weight for you, the individual, and their composure. I will be demonstrating later on a dumbbell curl. Be sure to have your body erect while standing, only isolating your arms in motion. Avoid swinging your arms to create extra momentum. This is called cheating the exercise. This causes your biceps to do less work to bring the dumbbell up towards your torso. If caught doing this, suggest lowering the weight to a more manageable level. Beginning the motion by bringing one dumbbell up at a time with the elbow being at the pivot point. Keep the other arm stationary and fully extended. When bringing the weight up, keep your upper arm at the side of your torso. There should be little to no movement in the shoulder at all. Bring the dumbbell to full contraction of the bicep, and once there, begin to slowly retract the bicep by bringing the weight down. Lowering the dumbbell should be done in the reverse order as you did when raising it. Slow and controlled movements are key when contracting and retracting the bicep. You would then repeat this for the next arm once that previous arm had the weight lowered all the way down. I will now show a proper demonstration of a bicep curl. As watching this video, take note of the individual's arms in motion. Notice the slow process in contraction and retraction of the bicep. The individual isn't swinging their body to lift the weights up and keeps his upper arm near his torso at all times. He also only focuses on one arm at a time to keep his body in equilibrium, to avoid swaying. Also notice how the elbow is at the pivot point for the motion of the exercise, and the shoulders have very little to no movement at all. The individual's feet also are firmly planted on the ground, creating a strong foundation for the exercise. Your primary focus when performing a bicep curl should be contracting and retracting the bicep muscle. You shouldn't rush yourself through these exercises as speed is not key. Slow and controlled movements are needed to properly train the bicep. Start with lighter weights and then go up in weights if it has become too easy for you. It is always safer to start lighter and then go heavier and adjust to the circumstances at hand. This form of a curl is mainly performed to enhance the bicep only and is not made to entirely train the rest of the arm. This is another angle from the other side, from the left side of the arm. The same process is used to perform the curl as seen from the previous clip before from the right side. Still notice the isolation of the elbow, as is the pivot point for the curl. The individual's body is still fully erect, and the movements of each arm are mirrored from one side to the other. You could also do this exercise while sitting as well, however the same principles are needed to do the exercise. Body fully erect, feet flat on the floor, elbow as the pivot point, and bring the dumbbell up to your torso. And a slow contraction and retraction of the bicep muscle. It's mainly just a personal preference on whether you want to do them sitting or standing. Some people prefer to do them standing, while some prefer to do them sitting. Both still, the primary focus is going to be to train the bicep muscle. Some injuries that can occur from this exercise include hyperextension of the elbow and bursitis of the elbow. Hyperextension occurs when the elbow is extended past its normal range of 140 degrees. This can cause damage to the ligaments by spraining them or even tearing them in extreme cases, which is usually caused by too much weight for the individual to handle. When hyperextension occurs, pain usually isn't noticed immediately during the training session, and it usually takes a couple of hours after the training session for the individual to experience the pain and symptoms of the hyperextension. Symptoms include pain, redness of the elbow region, both inside and outside the elbow, swelling and bruising as well. Resting the elbow is the best to do to heal this if it happens ever. Bursitis, on the other hand, is a different injury. Bursitis is caused when the elbow is subjected to increased inflammation to the joint as it fills with a fluid. This fluid causes limited movement of the elbow and typically creates a massive bulge over the elbow. This happens either due to increased stress to the joint, which can happen when using too much weight for a long period of time. This injury can take months to develop. That's why proper form and technique is so vital when doing this exercise every time you do it. Leg extensions have a very similar structure when compared to bicep curls, but the focus is on your legs rather than your arms. Your body must still be fully erect with your knees fully extended. However, do not lock your knees completely. If you lock your knees, you put any extra strain on the knee capsule itself. It can even damage the capsule and put too much strain on it. Have the metatarsals of your feet on the edge of the platform with your heels not touching the edge at all. The heels should be off the platform. This is to allow proper contraction and extension of the calf as you raise your calf up and down. Your feet should be your hips length apart, not together at all. All reps begin with your feet in a neutral position, and you start with lighter weights and move up as it becomes too easy. However, do not use too much weight as this can cause serious injury. This is going to be a video of a person doing a calf extension. Typically, it is easier to do this exercise standing up. However, we do not have the right equipment to perform it standing up, so instead we did it sitting down. However, these same principles are still used for both standing and sitting. Notice how the balls of the feet are the only part of the foot coming in contact with the platform. It's because your heels must extend past the base of the platform so you can stretch the calf out as far as you can safely without hyperextending it. The platform is then pushed on with the knees, without the knees bending at all. There's still little movement of the knees because they are not allowed to be locked. Be sure to keep your body stable by bracing it to the seat back and even, as you can see, grabbing into some of the support bars with your hand. This stabilizes your body to promote a safer lifting experience. There are a list of serious injuries that can happen if these are not done correctly. Too much weight can cause excess strain or tearing of ligaments and tendons in your leg or knee. And there are 3 levels of strains when it comes to this. A level 1, which is a mild strain, a level 2, which is a moderate to severe strain, and level 3, which is a total rupture of a ligament or tendon in the knee or the leg. A level 1 mild strain can last anywhere from 24 to 48 hours as the calf or knee was subjected to an increased workload. Symptoms of this include trouble walking, redness in the leg or knee area, and typically have to do with icing, and time is the best way to heal this. A level 2 becomes more severe as a tendon or ligament could have micro tears or it had been hyperextended. This can last upwards of 48 hours depending on the severity, and symptoms also include swelling, trouble bearing weight in the leg, walking, and redness in the leg or the knee. And level 3, which is the worst of the 3, obviously, is when the ligament or tendon had completely ruptured and may need surgery to fix as it has become completely ruptured. This is among the extreme cases, but can still happen if the correct protocols aren't taken beforehand when performing this kind of exercise. This is why it's so important to follow these proper techniques to perform these exercises, or serious injuries like this can occur. This has been my presentation on the proper form and technique for bicep curls as well as calf extensions. I just wanted to thank you for your time, and thanks for watching.